Hi, everybody. Kind of feels like old home week. We have Ed here, and you're here, and I'm here, and Shannon's here. Good to see you. Uh, if you just read the very first sentence, Pattern turns great pattern discoveries into world-class assets and sells them. That's the story. That's it. It's very simple. It might be different from what you're used to, but it's very simple. Hard to do. And I'll mention at the beginning, we are the top growth company in Keiretsu history. That may not matter, but here's what would matter. If you convert that into dollars, that means on paper at least, we've made more money for you guys than anybody else in history in Keiretsu. I'm very proud of that. And we want to continue doing that for you as we go. And I want to thank all of you who came in either individually or as a fund, I think twice, for helping us do what we've done. And so the rest of this is going to be about the fun part of what we've done. But we're just really at the beginning still. We're really just getting started. And I think you'll see that is true. We now have divisions in the company. We're still small with these 4 divisions, Prospectral. So Prospectral actually got a standing ovation at the Life Sciences Conference a year ago. I've never seen that happen before. We'll talk a little bit more about why that would happen, but you can see what it is. 3 seconds of test using broadband light instead of chemicals. We could do COVID with 98.8% balanced accuracy, single-digit cost per test, like $5. You can download new diseases on Wi-Fi. We think this is going to change everything in diagnostics. Project Starbright, we decided to prove that we were good at finding patterns by going into the hardest problems and the most worthwhile that we could find. So we went after the top 5 cancers, and today, here's where we are. We're creating 5 new novel patentable combo drugs against the top 5 cancers per month. And of those 5, we're creating 1 at least that is effective against those cancers per month. I'm just going to tell you, Pfizer can't do that. Merck can't do that, but we're doing that. And we're now about to file another raft of them. So we are going to file 5, I think, new prostate cancer drugs. So this is a new way of doing science. So I'll just say it that way, and I'll come back to it. We've found a better way of doing science. It was predictably better before we ever did it. We achieved the fact of doing it, and the result of doing it as a data-driven instead of a hunch-driven operation changed everything. Commercial pattern stuff, so there's a lot going on there. And I'll mention 2 new, so I'm going to try to give you a bunch of new, even if you're following us day by day, there are new things happening, so I'll try to share those with you. So one is, we discovered, before I get to that, we just signed a deal with, I can't tell you the name, it's one of the top 2 largest oil and gas services companies in the world. And the point for us is we want to get rid of coal plants right away. And we hope this is our way of doing that. We also are just signing a deal with, I won't tell you the name yet, one of the top 2 phone companies in America. You'll have to figure out who that might be. And we actually signed that deal yesterday. So we're doing well at what we had told you earlier, finding very large problems with very large customers, making very large discoveries, turning those into assets and selling them. TrueXAI, and I'm going to just take 1 second here. Everyone in the world, from IBM to Microsoft, tells you, and in a sense, it's true, that they have XAI. But it's also, in a sense, not true. So I just want to say this one time, and you can check it out. The Department of Energy says that Pattern is the only company in the world that really actually does have what they define as explainable AI. And that means that we wrote a paper with them with 35 co-authors, plus Cambridge and Yale, and made a mathematical description of what that means. And so whoever you are, if you claim it, you would need to pass that mathematical test to prove that you really did have it. You really did have the how and why things work. And we seem to be the only guys who have that. Prospectral. Well, we think Grail is our main competitor. You probably have heard of Grail. Grail was bought back for $7.2 billion by its parent a couple years ago. Pattern is, we're confident that Prospectral is a lot better. So you can kind of see why. 3 seconds versus 6 days, 98.8 versus 65 to 75. Grail only does cancer. We don't know yet. Berkeley says anything. We've done viral and bacterial. We think actually that's a really fair comparison. And then the question that ought to leap to your mind would be, as you move down the road with prospectral, what is it worth from day to day? Here's the addressable market. You can kind of make up any number you want to. There's a big number at the bottom. I'll mention now, here's another announcement we hadn't made until now. We just made our first sales of prospectral, the medical device or the research instrument, and we sold it to the DoD. So our newest customer is the DoD, and this is through the national labs. And when, I won't say if, when we do well in the very first use of this against 30 new diseases, then Berkeley says they'll buy as many as you can make. I said 1 million. They said, no, not 1 million, but a lot. So it's great to have DoD as our first customer for prospectral. It helps to underline it together with having national labs involved, what we're doing. One thing that's really important is we're adding diseases at a really fast clip. And that's the whole name of the game for us. We want to have one box, 50 to 100 diseases, 3 seconds of test, $5. You walk in and you walk out. Right? That's why we got a standing ovation at Life Science. So, right now we've got Celis and Chile testing 8 diseases. So RSV, flu A, flu B, COVID, and 4 more. We're going to do 3 diseases in India, TB, malaria, and HIV. And then we're going to do 30 diseases at Berkeley Labs for the DoD. And, we're getting there. We're getting there. And here's a new announcement that we haven't made yet. What's missing is cancer. Well, Grail, we're coming after you. We just signed a deal with a person who's the top human clinical trials expert in America, and she is a precision oncology expert, and we're going to do cancers with her. So we're really excited about the idea that we're going to move beyond viruses and into cancer. The idea here is, I think, pretty straightforward. When we try to look at the asset values of these discoveries, how do we measure it? Well, one way to measure it is how much money is somebody else spending to try to get the same goal. Now, last year, Merck spent 2 years ago about $4.2 billion trying to get into CGen to run triple-negative breast cancer against their Keytruda product, and it failed. Didn't really work. Keytruda alone really didn't work. So we have 2 products that are in their 5th round of positive testing right now against that disease. They spent $4 billion. That's just their poker chip. That's not the value of the market. The value of the market, if you actually get a hit, is much larger. And we had a guy recently tell us, you realize if one of your top 5 cancer results comes all the way through the market, that one drug will make you a multi-billion-dollar company. And he's right. That's still a long run for us. We're not there yet, but he's right. That's what happens with a blockbuster drug. And when you pick the top 5 cancers, it's going to be a blockbuster drug if it gets to the market. It's helpful when I say to you that we are doing something in a new way. You'd probably be skeptical. It's data-driven instead of hunch-driven. That makes sense to probably everybody here. By doing that, we are really different from the industry. When I say we're doing something Pfizer can't do, they can't. So look at this. Ovarian cancer, we measured the compute time to find a new drug and patent it from ingestion to final output. It was 6 weeks. I don't know, years, if you're in the industry. And then we have 5 novel drugs, and so I've told you, industry, probably never. How many drug companies of any size create a major new successful drug against the top 5 cancers? Often never. So it's hard. It's really hard. Pattern bio, risk reward. What we're saying here is our success rate, we measure it very carefully. When we did breast cancer, it was 11.7% success so far. So this was 5 rounds of testing at Charles River Labs. Industry, less than 1 out of 10,000 at that stage. There's really no comparison here. It almost feels unfair, but it's so exciting that you don't have to say it. So we have 7 new drug combinations proving effective against 2 of the top 5 cancers, and prostate is next. A brief moment about GPT. God bless it, it's a great thing. As you know, there was an open letter that Elon wrote. Elon's a friend of mine. Flew up to, when Elon was starting SpaceX, he flew up to my island to ask my opinion about it. And I said, great. You guys all know this. If you're technical, you know what I'm about to say next, which is there's failure built into GPT, into ChatGPT. Here's an Eric Schmidt quote. These guys are telling us all the same thing that I'm about to tell you. If I'll put it this way. A friend of mine who's the chief revenue officer at Stripe said, if you buy AI, you're going to have to buy explainability. It doesn't replace it, it just adds to it. You can't have a failure-prone system and use it, for instance, in medicine. Ask Watson how that worked out. Not one life was saved. Also a neural network. So you can't do it. And we're kind of, as you see the bottom here, same thing again. We're the only guys that have this thing. So we're really excited about this. So here are our new products. The family is called True XAI. The products are called ICE XAI and Neural XAI. ICE does what our engines have already been doing for 5 years. We can always interpret our own engines because we built them by ourselves. They're proprietary mathematics. We built them. They're new math. We know all about how they work. Therefore, we know the how and the why of what they do. However, with neural networks, no. And so after a 3-year secret project, we announced that we have a new way of doing this. We're calling it Neural XAI. Now, anyone who's got a forward-running neural network, we can tell them how and why that system in Europe, for instance, turned you down for insurance or for a house or whatever you're getting. There's one line in this paper. This is from the paper I was telling you about a minute ago from 35 co-authors and so on. When it says science in the 21st century will be defined by our capacity to learn from learning machines. This is exactly what we do. We didn't have it when this paper was written, but we now do. And I've got a, so this is our getting ready for the video. I thought the coolest thing I could do with you would be to take it out of the tell and turn it into the show. And the show part is, I'm going to show you. Maybe you could imagine if you were on our team and you're, in the pattern bio team, and you're doing a run against one of the top 5 cancers, and it's you. And what you're going to do is real work on real gene expressions with real tools that we own, built, with real results, and then real tests. And so we've done all we can to bring that to you today. This is a 1-week-old video. It's not perfect, but it's not horrible. And if we can roll them,
by results.
There we go.
In the world of bioinformatics, one of the key problems that we have is the size of the data set. In the ovarian cancer data set used in today's presentation, there are 15,554 gene expression levels, here with the names obfuscated for the presentation purposes, and 146 patients. That is a large matrix, and the number of months of survival after diagnosis is the target against which these graphs are trained. The size of this data by itself is intractable for the purposes of trying to determine which particular gene expression levels might reflect processes and interactions biologically that could have an impact on the number of months of survival after diagnosis. However, we bring it to our pattern discovery engine and submit it to intelligent dimension reduction. Now, here we see 4,216 of the gene expression levels from the original data set, except these particular gene expressions are those that potentially have the most impact on the number of months survival. But as you can see, it's still an intractable problem. If we imagine the 146 patients at the center of this mass, and all of those levels and interactions occurring on a biological level in each cell, possibly potentially impacting the progress of the cancer, it's still an intractable problem. However, the problem of complexity can be reduced by the next phase of our dimension reduction, which also includes finding patterns. Here we have interaction pattern propositions. Those with the solid edges, as seen here, have the strongest potential impact on the number of months survived. Those with the dashed lines are in the bottom 90%. From this, we can begin to understand possible interactions between gene expression levels as pertains to the outcome, but still not enough corroboration. So we submit it to multiple passes. Here we're seeing 5 multiple passes. In the results I will present later, 20 multiple passes were used. Now we begin to see corroboration in networks in these patterns. Subject matter experts can begin to investigate this, and they can see whether there are novel or known interactions in the ovarian cancer space and whether or not they correlate with these particular findings. Once we determine which are the most targetable in terms of the drugs and the combinations that we will be using, we then reduce our set to those in a tractable space. These are the actual combinations that were tested in vitro to determine whether or not they would continue on for consideration. Each pair represents a drug combination. We submitted them to testing, and here we see that some tests failed, those with the dashed edges, and some tests passed our criteria, those with the solid edges. Now let's just take a look at some specific results on one particular pair. Look at that. In this particular pair, there are two drugs. As we alter the level of one, we get a certain amount of inhibition. As we increase the level of the other, we get a certain amount of inhibition. Combined, they have a synergy that brings us to our next stage. We took 4 such combinations with a contract research organization and prepared these drug combinations for testing in a xenograft model, high-grade serous ovarian cancer over 15 days. And our results are shown here. Look at that. No tumor growth in 2 of our 4 submitted combinations. That's amazing. As can be seen here, the vehicle, which has no drug in it, well, the tumor grew very quickly. We had 2 combinations that did not test well, and we had 2 that tested amazingly. It's very easy to be proud of the Pattern Computer team. Look at these results. We still have synergy testing to be done, and we will get back to you with those results when we have them. Thank you.
So this is real. We're living this right now. And there are 239,000 women who die, who are diagnosed, and 140,000 who die worldwide from that disease. So I'm almost done. So here's the assets I've been telling you about. What are they worth? Prospectral, we don't know. 7.2 is the peak. It's probably worth $2 billion now. That one thing is worth more than the value of our company. Pattern Bio, 13 pipelines, 7 new drugs, we're gonna be 12 drugs. One of those drugs is worth more than the whole company. TrueXAI, we haven't even started yet, but we've been to Europe twice, getting it ready to go to Brussels. That's probably worth it more than the other ones. So we feel like we've done a good job converting your investment into really, really important global assets. And we're in our B round. We'd love to have your help again. You guys brought us to the dance, and we're never gonna leave you. Even when we have others like the top 2 banks in the world helping us, we wanna have your help too. And we do all we can to make it easy for you.